Comparison of different biopsy forceps models for tissue sampling in eosinophilic esophagitis. Introduction. Eosinophilic esophagitis, EOE, is a chronic inflammatory disorder of the esophagus, rapidly increasing in incidence, and characterized clinically by symptoms related to esophageal dysfunction and histologically by eosinophil predominant inflammation. In itself, this definition underscores the importance of the histopathological assessment of the esophageal tissue. Systematic evaluation of scarce surgical resection specimens, as well as findings from endoscopic ultrasound studies, have convincingly shown that, in EOE, the inflammatory processes are not restricted to the squamous epithelium of the esophagus, but also take place in the deeper esophageal wall layers, in particular the lamina propria of the mucosal layer, the submucosal layer, and even the muscularis and adventitia. It is well established that uncontrolled inflammation in EOE can lead to subepithelial fibrosis characterized by excess deposition of extracellular matrix proteins. This so-called esophageal remodeling leads to stricture formation, which increases the risk of food bolus impaction. Subepithelial fibrosis might contribute to EOE symptoms despite apparent mucosal healing. As such, processes taking place in deeper layers of the esophageal wall most likely contribute to symptom generation in EOE. In EOE, it would be advantageous to get biopsies that encompass subepithelial tissue as well as epithelium. The reasons for this are twofold. One, it would be of interest to physicians and scientists alike to be able to examine disease-specific alterations occurring more deeply in the esophageal wall and to improve our understanding of the pathophysiology of EOE. And two, it would help pathology technicians to properly orient biopsy specimens, epithelial side up, which in turn would make it easier for the pathologist to evaluate the distinct EOE-associated features, such as basal cell hyperplasia or papillary elongation. Although subepithelial esophageal tissue is not routinely sampled, several models of biopsy forceps currently on the market can be used to potentially obtain this tissue. However, there are no studies so far that have systematically assessed the success rates for sampling subepithelial tissue achieved by endoscopists using different biopsy forceps models. Furthermore, it is unknown whether sampling of biopsies containing subepithelial tissue is associated with complications, such as bleeding necessitating an endoscopic or surgical intervention or esophageal perforation. Given the lack of studies that systematically examine the use of different biopsy forceps in patients with EOE, Bussmann et al. Aimed to evaluate the rates with which 4 different biopsy forceps models can be used to successfully obtain biopsy specimens containing subepithelial tissue, and the amount of tissue that can be sampled using these forceps. In addition, the authors also examined whether inclusion of subepithelial tissue is associated with obtaining sections with proper basoapical orientation. Lastly, the authors examined whether the deeper biopsy sampling is associated with complications, such as bleeding or esophageal perforation. Background and aims. Eosinophilic esophagitis, EOE, is a mixed inflammatory and fibrostenotic disease. Unlike superficial inflammatory changes, subepithelial fibrosis is not routinely sampled in esophageal biopsies. This study aimed to evaluate the efficacy and safety of deep esophageal sampling with 4 different types of biopsy forceps. Patients and methods. In this cross-sectional study, esophageal biopsies were taken in 30 adult patients by 1 expert endoscopist. Biopsies sampled from distal esophagus using a static jaw forceps were compared with proximal biopsies sampled with static jaw, alligator jaw, and large capacity forceps. 1 pathologist calculated the surface area of epithelial and subepithelial layers in hematoxylin and eosin, H&E, stained biopsies. Results. Subepithelial tissue was acquired in 97%, static jaw FB11K1, 93% static jaw FB45Q1, 80% alligator jaw, and 55% large capacity of samples, median interquartile ratios of surface area of epithelial to subepithelial tissue were static jaw FB45Q1 1.07, static jaw FB11K1 1.184, alligator jaw 2.353, and large capacity 2.71. The static jaw models obtained a larger surface area of subepithelial tissue compared with the alligator jaw and the large capacity forceps. No esophageal perforations occurred. Conclusion. The static jaw forceps models allowed sampling of subepithelial tissue in more than 90% of biopsies and appear to be superior to alligator or large capacity forceps in sampling larger amounts of subepithelial tissue.